Hi everyone, I am Dr. Sanjana Vebi from SIHMSR and today I am going to discuss with you an important clinical condition, neurodevelopmental disorders. This video is exclusively for homeopathic doctors across the globe, and today we are going to discuss the scope of homeopathy and a particular drug in detail, that is tuberculinum. We know that neurodevelopmental disorders are very common nowadays, and it is rising in a great pace that many parents are worried about neurodevelopmental disorders in their children. Although it affects chiefly children, or also it is detected in the childhood, many cases progress to adulthood. Sometimes cases may be undiagnosed during childhood and it may be detected during adulthood. Although it is rare, most cases are diagnosed during childhood. The reason for this discrepancy is there will be a wide spectrum in NDDs. In each NDD comprises, NDD means neurodevelopmental disorders, comprises several clinical conditions like ADHD, autism spectrum disorders, contact disorders, learning disorders, cerebral palsy and schizophrenia. It includes tic syndrome also. And neurodevelopmental disorders each, that is ADHD, ASD, whatever it is, each neurodevelopmental disorder has a wide clinical spectrum from mild to severe cases. Mild cases may get unnoticed during childhood, and when the symptoms become evident under favorable conditions, it is diagnosed as an NTD. It's possible, and then too homeopathy will help in managing the symptoms as well as the disease. Today I am going to explain NTDs in general, not in particular. I would like to explain the definition of NTD. NTD is an affection of brain, as you all know, that it impairs the social, cognitive and emotional functions of brain. It affects the neuronal development of brain. As a result, there will be problem with learning, problem with memory, problem with emotions, cognition, communication, and sometimes social behavior is affected. It depends on the neuronal area affected or the brain area affected and the type of disease or the genetic component of the disease, type of a genetic component of the disease. Okay, and what causes NDD? A concrete evidence is lacking regarding the etiology or causation of NTD. However, the researchers and the medical science believes that genetic factor play a key role along with the environmental factors and epigenetic changes. Of late, there are researchers which points out that some prenatal factors contribute to the development of NTDs, like diet of the mother, medications of the mother during pregnancy, and some emotional traumas during childhood, and some conflicts in the parents, a toxic environment because of parental conflicts, conflicts between the couples, and sometimes neglect from parents may contribute to NTDs. But more than all these factors, a strong genetic component or an epigenetic change is responsible for NTDs. Epigenetic change means in which there is no structural alteration of DNA, but DNA and gene operations functions are impaired in epigenetic changes. Epigenetic changes are studied by the medical science, or especially the molecular biologists across the world with respect to many diseases, not only NTD. Epigenetic changes play a key role in the development of many diseases. Many diseases stems from such changes, and whether homeopathy can alter it or not the researchers in homeopathy must go behind the epigenetic change and our medication research. Research is very essential in homeopathic medical science. Although many researches are going on, the ongoing researchers are not focusing epigenetic changes. I know a few molecular biologists and scientists are focusing on genes and homeopathy, genetic changes, genetic diseases and the role of homeopathy. However, more researchers are needed in this area. Let's come back to our topic, that is NDD. NDD symptoms I already described in general, because ADHD, autism spectrum disorders, everything is known to the homeopathic physicians who are listening this video. I don't go into the details of ADHD and all. Let's have a glance at the prevalence of NDDs globally. NDDs are seen mostly in male children, especially in toddlers, in school-going children, preschool children. The male to female ratio is 4:1. And another feature of NDD is each disease or clinical condition in NDD, like ADHD, autism spectrum disorders, the learning disorders, conduct disorders, whatever it is, shows a particular comorbid association. That is, a patient having ADHD may have autism also sometimes. It's not necessary always to have autism and or any other comorbidity to have, but there is the science and the researchers has noticed that autism and ADHD coexist. Similarly, learning disorders and behavioral disorders coexist, conduct disorders. So the concerned physician who attend the patient must be aware of this fact and must try to differentiate between the clinical conditions coming under NDD. Of course, there are overlapping of symptoms, but we must take into account the disease with its comorbidities, so that we can manage the disease with the adequate measures, interventions. Okay, and the most important factor usually physicians fails to notice is the impact of NDD on the parents. Mostly children are affected in NDDs, but the parents who are taking care of the children must do great adjustment. A lot of adjustment must be done in order to make the life of the child very comfortable and happier, because unlike other children, they will have some stubborn, adamant approach towards life, and they will be very violent sometimes, and sometimes there will be difficulties in learning. All these are not affecting the child alone. Parents are also worried a lot about it. So the concerned physician must give directions to the parents as well. There must be, if necessary, medicines must be given to the patients, light medicines to pacify their angst, their anxiety, their stress, and some measures, general measures to reduce their anxiety and stress, because the stress itself may cause disease in the parents, other diseases, physical and mental diseases. So that must be our priority in managing in these cases, because once the home ambience or the work ambience is in the right way, is in the ordered way, organized way, with the stress reduction, the management is easy. Okay, you all know that well. And I come to tuberculinum directly. Tuberculinum, we know that it's a homeopathic noso taken from tubercular abscess, and we know that tuberculinum child has a physical constitution. It is known to all, that is emaciation, narrow chest, and light complexion child. It's not necessary that always light complexion. We can apply tuberculinum in dark complexion people also. And it's just like the food and cravings. I don't give much importance to the cravings if other characteristic match with the remedy while choosing a remedy for a clinical conditions as described. And the emotional side of the patient, very affectionate child is tuberculinum. Usually people misinterpret the violence as the character of the patient. Violence is triggered sometimes, but usually tuberculinum child is very affectionate, very sweet child. He is very absorbed in his own activity. If we try to distract him from his activity, or he is frustrated in some other matters, there will be violence. He will break everything, he will throw things on others, whoever it is. He will not be aware of the affection or the relation between him and others at that moment. There will be intense violence sometimes. But generally the basic nature of the child is very affectionate child. Affection means extreme affection. Extreme affection can be noticed in tuberculum children, and they lack confidence internally. They will be doing so many things, but internally they lack confidence. They will be nervous, and we must address that nervousness through medicines as well as counseling. And a parental training must be given in this regard, and we must try to talk to the patient when he is in a good mood, or when he is able to focus on those matters we are trying to explain to him. Because I say like this, in the initial stages, if it is ADHD or autism, whatever it is, comprehension is difficult, and focus will not be there, distraction is too much. In the initial stages, without the aid of medicine, it is not possible to talk to the child. It's my experience, my clinical experience. And at that stage we will go for some medication. Sometimes the hyperactive child will be destroying so many things in the clinic, and they will be internally very restless. Tuberculinum is internally very restless. While treating ADHD, we can go for tuberculinum directly if the symptoms agree with the clinical conditions and of the patient. We can give tuberculinum. Otherwise, to pacify the violence, we can go for some other drugs like stramonium and chamomilla, tarantula, etc. But as a constitutional remedy, I am describing tuberculinum here. That depends on the physician, how he or she approach the case. As far as I am concerned, I am very much patient friendly. More than adhering to the principles of homeopathy, I would try to pacify the patient first with some other drug. If not only in ADHD, in whatever be the clinical condition, if patient is in agony, I will go for protocols, some specific remedies. If there is pain, I will go for pain remedies. Only after that I will go for a constitutional prescription, because sometimes it will be necessary for gaining the confidence of the patient. Every time we cannot try to narrate the principles or explain the principles of homeopathy to the parents. When a child is in agony, of course any parent will want the symptoms to be relieved as fast as possible. So at that time I will not try to explain the principles of homeopathy to the parent. In such a condition, if the patient is too much wild, we can give some other drug. If tuberculinum is not able to, if you are sure that tuberculinum is not sufficient in this particular occasion, you can go for some other acute remedy. After that you can take the case. If the case and the symptoms agree with the tuberculinum, we can give tuberculinum. Otherwise, many other remedies are there in homeopathy as to be given as constitutional remedy. And come back to that symptoms of tuberculinum. What defines tuberculinum? Dissatisfaction, intolerance, and innovative mind is the three important characteristics of tuberculinum remedy. Tuberculinum, if we study as a person, we all homeopathists know that we study medicines as persons. So dissatisfaction and intolerance. Intolerance is a tubercular trait, tubercular miasmatic trait, and dissatisfaction also. Because of that, there is a desire for constant change in tuberculinum, and a patient wants to travel a lot. He cannot sit at one place. He would say, I must go there. Constantly want to travel, constantly want a change. That is the characteristic of tuberculinum mind. And tuberculinum is search of something new, be it a child or an adult. We can see so many people who is not satisfied with what they already have, And not because they are greedy, they may not be interested in money and all, but there will be an inner calling. This is not sufficient, I must do this in that way, in a particular way. I must explore. That's the right term defining tuberculinum. Tuberculinum want to explore in an extreme degree. That's the characteristic of tuberculinum as a person. We all must explore. That is very essential for advancing in life, and a level of considerable level of ambition is needed in life, so that life will be easier, and we must have a goal to pursue it. But in case of tuberculinum, there is some level of eccentricity. It's normal, it's beyond the normal ambition. Tuberculinum wants to explore more, new ideas. We know that many billionaires, many scientists, many inventors have suffered from NDDs in their childhood. We know that. I don't mention the name of a particular person here in a social platform like this. I don't think that it is good to mention the name of a particular person, but many billionaires, if you take the history of many billionaires, many scientists, many inventors, we can see that they had some neurodevelopmental disorders. In people having this, the intellect will be, in some cases intellect will be impaired, but in some cases they will have extreme intelligence, intellectually very keen. And we can see the two extremes in tuberculinum. And their dissatisfaction, their desire for constant travel, constant change, explorative mind, all this makes tuberculinum restless. Tuberculinum wants change at physical and mental level. So constantly traveling, exploring, that gives satisfaction to tuberculinum. And the intolerance we can see in physical level also. In physical level, it is expressed as allergies. My vision about allergy is that it's an hyperimmune response against a foreign body. The immune system is responding in an hyper way against an allergen, and that is an intolerance of the body, and that intolerance is allergy. Most tuberculinum children suffer from respiratory allergies, respiratory catarrh, relapsing fevers, and constantly they must consult a physician for respiratory affections. That is very much characteristic of tuberculinum. And regarding the physical features, we must notice that it may not be present in every child, but the presence of hairs on the cervical region down the spine we can get in tuberculinum children often, not always. And tuberculinum is susceptible to cold. He gets cold easily on exposure to the least cold ambience or cold atmosphere. But the fact is that tuberculinum loves open air, wants to be on open air. Both the physical and mental symptoms are relieved a lot by sitting in the open air. Very calm on watching the sky, watching the open air, the greenery around, the environment around. And tuberculinum is pacified by sitting, or the mind is quietened a lot by sitting in the open air. And we can see cervical lymphadenopathy, not only cervical lymphadenopathy, but generally lymphadenopathy or lymph node enlargement in the body of tuberculinum patients, because some frequent infections are there. Sometimes it is not necessary that TB always, because our text says that sometimes there will be a family history of TB or infantile TB in the patient, but any respiratory, chronic respiratory or any other infections, general infections can cause lymphadenopathy in the body, and tuberculinum is susceptible to infections. Okay, and the next point is tuberculinum wants to be involved or absorbed, actually wants to be absorbed in their own activities without any distractions. That is a characteristic of tuberculinum child. He may be involved in some particular activity, even if there is ADHD. In all the patients I got in regarding ADHD as an NDD, there was some particular affinity or like for a job or an activity. Some children had desire for mechanical works. Some were involved in some games. They had problem only with learning. They cannot focus on learning in school, learning textbook, but they were able to learn in some other way. So they were absorbed in some particular activity that is characteristic of tuberculinum. And when we distract the child from that particular activity, there was great violence. And when the child is frustrated, there was great violence. That means child may want everything new. New means at one time he may be active or he may be involved in a particular game or with a toy, but next moment he wants something else. If the desire is not gratified immediately, there will be violence. He gets frustrated. That kind of behavior is very prominent in hyperactive children, and tuberculinum can cure that, manage the symptoms very well. And I don't say that tuberculinum is the only drug for managing NDDs, be it learning disorder, conduct disorder, or ADHD or autism spectrum. It's one of the main drugs we give for managing all this. And my opinion regarding the dosage and repetition is, in case of these kind of diseases, tuberculinum should not be repeated often. I take almost 40 days to review the change, if there is any change, and after that I will go for repetition if necessary, otherwise on placebo, or if another remedy is indicated. If tuberculinum has relieved a group of symptoms and only a few symptoms remains that points to another remedy, I will go for that without being concerned about many of the principles. But tuberculinum has given great results in managing ADHD. So today I would like to describe the remedy. Okay, and that's all about tuberculinum. You can ask your doubts, your opinions, your comments in the comment box, and I and SIHMSR is very keen to know about your comments or your opinion about our lectures. Please keep on watching. Thank you.